things started. Hello, everybody. Welcome to the Standing Committee on Health and Social Development. It's Wednesday, January 22nd, 2020. And we're excited about this meeting, and especially excited for, this is Sean's first duty as clerk. So this is his first meeting that he'll be clerk. So we're excited about that. Yeah, so. Well, you did. Just want to welcome the members of the committee, Heath MacDonald, Hannah Bell, Trish Altez, Jamie Fox, and Corey Deagles, going to be representing Brad Trivers. As well, we have Rob Henderson joining us and Peter Bevan-Baker. So welcome here today. So can I get an adoption for the agenda? Or motion? Hannah Bell.
Second.
Seconded by Mr. Fox. Okay, so today we have a lovely amount of time for a briefing from the South Shore Health and Wellness Incorporated. So welcome here today, and hope you take your time. And this is a very important day. And what we'll do is we'll allow you to do your presentation, and then after that we might open the floor to questions. So without further ado, if you want to take a second to introduce yourself to the people at home and here, and then you can begin your presentation.
Well, thank you, Mr. Chair. Thank you for the opportunity of having us in today, and we're looking forward to do this with a fair bit of optimism, I must say. And thank you to the other members of the committee for your giving up your time to be with us today to hear from us. So I'm privileged to have with me two persons who are members of the committee that was formed back in 2017. Matt MacFarlane is my co-chair, or I'm a co-chair of that committee, and a director and the current secretary of that committee is Lisa Gallant, who is our local pharmacist, but she's also a very valued member of the committee, and has worked extremely hard with the board in getting to where we are today. So, if you allow me, Mr. Chair, to just go back a little bit in history for you. It was in November of 2017 when we found ourselves, not through any fault of anybody, and we're not here to lay blame on anybody. We're here because of a situation that we find ourselves in, and we're determined to try to improve our situation so that we're not in a situation that we're losing health care in our area. But in November of 17, there was a meeting called, a public meeting called, and it was standing room only in the local hall, and an awful lot of people turned out with a lot of people with a lot of questions as to where to from here. And at that meeting, there was a number of individuals who expressed themselves in very fluent terms that they wanted to have a situation remain in Crapo that had suddenly been taken away. Dr. Visser had been our local physician for quite a number of years, to a point that I guess we took it for granted, because he was always there. And he served us very, very well. He then had sold the practice to another gentleman, and the other gentleman came in and practiced for a very short period of time, and then for whatever reason, and we're not here to judge or anything like that, he decided to go to Cornwall and leave the area of Crapo, selling most of his stuff off, or prepared to sell most of his stuff off. So the decision was pretty well made at that meeting in November that we were going to do something to remedy the situation that we found ourselves in, because going back to about 1830, there had been a physician always in Crapo. A number of us who've been around there perhaps a little bit longer, because in my case I was born there, remembered a number of physicians who were part of the community, if you like, and people who served us very well and did a great job. So shortly after that period of time, there was a meeting held of interested individuals, and all of a sudden we found ourselves forming a board of directors with individuals who had volunteered to step forward because of what they felt was the need to have health care in the area. And because of that, they incorporated a not-for-profit organization with a group of people who were of one mind, if you like. And in that discussion, one of the things was where would we locate? Because at that time we really didn't have anything. Dr. Visser's place had been sold to Dr. Giordani. I suppose we could have looked at buying it back, but the majority of the people at that meeting in November of 17 felt very strongly that we should start over again, and that the proper place would be build a facility in very, very close, if not connected to, the existing pharmacy, which had been just recently built, which was providing a service to the community. So because of that, the decision was made that this is what we would do. So there was a planning committee out of that board of directors fell in place and started to work on the construction of, and this was all led by Lisa Gallant at that time, who was, as I said, the current pharmacist. And it was going to be built onto the building that was the local pharmacy. So the work began, and all of a sudden, today we've got a clinic with rooms in it that will allow us to have various health professionals there to serve the public in the area. And I would say we've come a long way. We're very proud of being able to have accomplished that process. So then our undertaking was to promote, support, and advocate for continued health care for the residents of the South Shore area. And one of the things that the committee has done, the board of directors have done, is attempt to engage government and work with government to start on a very preliminary bit of work of recruitment. And I and another fellow board of director member by the name of John Visser, who is in charge of fundraising. Now you might ask, why are we doing fundraising? Well, there are various individuals in there providing services to the general public, but hey, we need Band-Aids, we need this, we need that, as supplies, if you like, at the clinic, in order that the patient who is being served by whatever health professional is there leaves being totally looked after. So the board of directors saw fit to do some fundraising for that, because we want to be able to supply a complete service, because we've got people who are doing walk-in clinics, and this type of thing is an ongoing, not the ideal. And of course we've got one nurse practitioner, but these are services that are being provided by professionals. They're not expected to be buying supplies for them, so we have taken care of that. So where are we at today, and my colleagues will be going over various other aspects of where we are. But I must say, Mr. Chairman, that we're quite pleased when we look back at November 17 and from where we started from and where we are today. We've come ahead for sheer love of the area, because all of us have a strong belief that there are a number of people, including individuals who are patients of South Shore Villa, who traveling is very difficult for them. If they do, it's probably in an ambulance. So we need various persons there who can provide services in the area. We now got a facility in place, which we're proud of. We just need your assistance, government's assistance, in getting some more health people in place that they can provide a full slate of services to the people of the area. So I'll turn it over to you, Matt, if you don't mind, please.
Thank you, Elmer. I'll speak to a few more slides, and then Lisa will carry us through to the conclusion. And I guess we'd be happy to take questions, obviously, at the end. We'd love to have a good engagement. So, just very briefly, primary health care is the buzzword of the day for many jurisdictions, and how do we achieve optimal primary health care, and what does that model look like? We have a general understanding, I think, collectively as to what primary health care has looked like, and the challenge is what does it look like going forward, and what's the best model for primary health care. We've seen an evolution towards sole practitioners, family physicians, operating on their own, such as Dr. Visser did for 35 years, and so many other single practicing doctors around the communities, to more of a collaborative nature, where you have physicians working in collaboration with nurse practitioners and other health professionals in the community. So we recognize that as a board, and what we've strived to accomplish is to build a model that's reflective of the direction that we see, not just in PEI, but around the country and around the world, primary health care moving in. So, as Elmer has indicated, we've created a space that we believe recognizes the direction for movement of primary health care. It is the first point of contact for medical care. So really what we're talking about too is the goal of preventative medicine. So as the patient is in the system longer, the expenses will rise. If you can access primary health care and access preventative medicine, our position is that you're going to be reducing cost down the line as the patient moves into more expensive care and treatments such as scanning technologies and specialist care. So that's a bit on the primary health care. The new primary care, as already touched upon, provides a number of different approaches and different practitioners to provide the optimal care, and each practitioner to work within an area of expertise, and allows the patient to receive more holistic care with educational components. And that's what we're trying to accomplish as well with our clinic, is an information piece, an educational piece, which would allow patients to access good quality information, not just Google or Facebook medical information, but real expertise on how to manage care and preventatively manage what they might have as a chronic illness. So our vision, put very succinctly, fits what we see as that model of 2 full-time nurse practitioners working in cooperation with a family physician. So the supports are there for the nurse practitioners, the support is there for the physician in a collaborative setting. And that model fits an industry standard of 2,800 patients, and it works well in our research for communities and for patient populations in that range. Multiple examples do exist of such collaborative clinics throughout the province, including some smaller and larger communities as well. That's the model that seems to be working. In our community, we do have 2,800 patients without a physician in the South Shore area. That would represent Dr. Visser's complement of 2,300 patients, plus there were 500 on the registry before he retired. We have come to the conclusion, based on our reaching out to the residents in the South Shore area, that Crapo is where they would like to have their care centered. Dr. Visser's patients came from a broad geographic catchment area: Albany, Borden, Carleton, Tryon, Breadalbane, Kincora, Hampton, Disabled, Bonshaw, and areas in between, and also areas beyond that as well. Whether people relocated into the area or otherwise, there were, Dr. Visser had patients that extended beyond the South Shore catchment area. And Crapo is the geographical center between Summerside and Charlottetown, which will catch patients from the South Shore through to the north side. Elmer touched on the community outreach that we have performed. We had 3 public meetings. We've arranged, in conjunction with the Women's Institute, for petitions to be circulated and presented to the legislature. Most recently, Minister Fox presented the most recent petition from the Women's Institute, where there was over 1,300 signatures indicating their support for the clinic in Crapo and for care to be delivered through the clinic in Crapo. We have also, as South Shore Health and Wellness, we've completed health needs assessment surveys, which went out to 3,600 households. Overwhelming response was 92% of respondents wanted primary care to be delivered in Crapo. So the impact on our residents: we have 2,800 patients presently driving to Charlottetown for medical appointments, and we also, as Lisa will touch on, the walk-in clinic is providing a stopgap measure as well for the patient population. Those are a couple of the quotes up on the slide that we've received back in our outreach to the community through our needs assessment survey from 2018. Transportation is an issue. And whether we're talking transportation to a clinic or whether it's to something like dialysis, studies have shown that if patients have to travel a longer distance to get to that care, their health suffers. So the best way to address chronic illness and to provide optimal patient care is to deliver the service closer to the patient's home. And that reduces illness on community and on society. So concentration of people with no continuity of care. Most recent population statistics that we could find shows that our island population has reached the lofty goal of 155,000 people. Presently, we understand there to be at least 16,000 islanders on the provincial registry, representing about 10%. In our area of the South Shore, we have 8,000 residents presently with no family physician. 2,800 rather, in the population of 8,000, which represents 35% of the residents in that area that are presently not served by a family physician, or, as I would say earlier, access to primary care. And those people in that geography are getting insufficient care and insufficient follow-up and insufficient continuity for the treatment that they would require for whatever illness or needs they have. So with that, I'll pass the slide over to Lisa.
Thank you, Matt. So I'm going to talk to you a little bit about what South Shore Health and Wellness Inc. has been up to over the last 2 years. We've been very busy. We've met with many levels of government. We've met with, I think, 3 ministers of health. We've met with many MLAs. There's not too many stones left unturned there. We've met with Lfpei recruitment and retention staff. We've met with the Lfpei directors of primary care. We've also met with Lfpei's managers of primary care for Queens West and East Prince. Our Crapo falls under the primary care network of Queens West. So we've certainly been around the block. We've talked to a lot of people, and we feel like we have a good understanding of what's been happening. We've gotten involved with recruitment to the extent that we're able. We have posted ads on physician job sites. We've put up posters at Dalhousie University and Memorial University in Newfoundland. We've put ads repeatedly on Facebook, specifically targeting areas where we know they've had good success recruiting physicians, so South Africa, Ireland, for example. Winnipeg apparently has more doctors than they need, so we've been targeting those areas. Every spring, we also reach out to the Family Medicine Residency Program Coordinator, and that's the person who helps the medical residents as they're about to be licensed, like fully licensed, to move them into practices. So we always sort of contact that person to offer maybe taking the new graduates out for supper, maybe getting them together informally with some of the physicians who are doing the walk-in clinics in Crapo so that they can ask questions about what the patient population is like or what it's like to work in Crapo. So we've done that the last couple of years. We also have an offer on the table for any physician who wants to practice in Crapo, where we would provide free medical equipment for their use, and the first year at the clinic rent-free. So a newly practicing physician coming to our area could walk in with no upfront costs, essentially. We also have gym and curling club memberships in our community offered for free for physicians. You can't see, it doesn't translate very well up on the screen, but that is our poster for recruitment, which we think speaks to the lifestyle that people could find in PEI. So let's talk about the barriers. I believe that was one of the, what we were asked here to speak on, one of the issues. Ironically, we feel over the last 2 years, our biggest barrier is Health PEI's centralization philosophy. And I'll explain to you how we arrived at that conclusion. Initially, when the physician left Crapo, Health PEI would not let us advertise the physician vacancy as Crapo. They are not advertising the vacancy as Crapo. The family physician position is open to all of Queens West, which includes Charlottetown, Cornwall, Hunter River, and Rustico. So if a physician comes and wants to take on Dr. Visser's previous practice, that physician can choose to locate in any of those areas, which we don't feel is ideal. And again, we were told we were not allowed to advertise. We were not allowed to use that poster. We did anyway. But we just feel like that speaks volumes to where the priorities are. Furthermore, if you go on to Casper, which is a very popular recruitment website for physicians, you'll see that Dr. Visser's previous practice is advertised as a vacancy in Charlottetown, which we find concerning. Furthermore, back in December of 2018, 2 nurse practitioner positions were approved to address the vacancy of Dr. Visser's practice, and one of those nurse practitioners was sent to Crapo. We are abundantly thankful for that service. She is fabulous. She's taken off so much anxiety from our residents with regards to their health care. There's just no way one nurse practitioner can look after 2,800 patients. It's impossible. And unfortunately, the other nurse practitioner position went to Cornwall despite our objections. So because so many of the residents want care in Crapo, the nurse practitioner in Crapo is booked for 4 weeks in advance and has been essentially since she started. So if people can't wait 4 weeks to see her, they're being offered appointments in Cornwall. Unfortunately, if they accept an appointment in Cornwall, their file stays there, they can't move back. So the result of this situation is that services are being moved and people are being moved out of a rural area into an urban area. For us, we see Cornwall just as an extension, essentially, of Charlottetown. Those are more urban areas. So we find that concerning. What might be of concern to other communities is last year Health PEI centralized all job postings for physicians. So previously, if you went on the Health PEI recruitment website, you would see vacancies posted for Kensington, Alberton, Tignish, O'Leary. Now if you go on to that site, you will see that the vacancies are just posted by Health Network. So Tignish, Alberton, O'Leary are all lumped in under postings for West Prince, East Prince, so Kensington, Summerside, those are lumped together as East Prince, and all of Queens West is all lumped together. So essentially, I'm not sure if there's anything protecting those physician positions in those communities any longer, or if the physicians who take the position can just go to whatever community within that health network they want to go to. So I think that should be a concern in a province where so many of our residents live in rural areas. So we all know this, over 50% of our residents live in rural areas. So I think there should be some concern there. Furthermore, South Shore Health and Wellness met with the new Deputy Minister of Health not that long ago, where he explained what's Health PEI's new direction. This was our understanding of the situation that Mark Spidell explained to us. He said, going forward, Health PEI will only be supporting clinics with a minimum of 4 to 5 physicians working under one roof. Again, we're not sure that that's the best model for a province where so many of our residents live in rural areas. That would leave out many PEI communities. So if you look at all of the health clinics run by Lfpei currently, Kensington, Rustico, Hunter River, Tignish, Tyne Valley, Alberton, none of those facilities have 4 to 5 physicians, and several only have 1. I thought it was interesting that you had Chief Public Health Officer Heather Morrison in last week, and she spoke about good health care is about community development, and grassroots community-driven initiatives and programs are important to health and well-being. We couldn't agree more. When you look at what we've done, we have community-driven health care. So with no help from government, we, in the span of 2 years, now have walk-in clinics in Crapo 3 to 5 times a week. We have 500 patient visits per month. We're offering physiotherapy, massage therapy, and acupuncture. We have diabetic foot care. We have hearing screenings, and we're delivering health-related seminars. We have a lot of community engagement. As you saw with the petition, 7 different Women's Institutes groups came together to deliver that. We have a letter that just went to the Premier. 5 communities signed a letter advocating for primary health care in Crapo. So Kincora, Crapo, Victoria, Breadalbin, and Bonshaw all agreed that this was important for their communities. We have local volunteers transporting specimens from the walk-in clinics to the Queen Elizabeth Hospital 4 to 5 times a week. We have incorporated a 12-member board of directors, and we have over 100 members. I want to use an example of some other smaller healthcare clinics, such as in Rustico and in Hunter River. They do have grassroots initiatives where they're delivering well-being programs to people, and it's not costing government anything. So they've had healthy cooking classes, they've had walking clubs, they've had other like health seminars. They've written in the newspaper healthcare advice articles on a monthly basis. So these are ways that government can get well-being initiatives from the grassroots community without really any government investment. So I think we have to think about that when we're talking about community clinics, because they're all linked together. That's a rallying point for these communities. And you know, I think we want vibrant rural communities, and that's going to be difficult if we're centralizing all of our services in just Charlottetown and Summerside. I know it's not Lfpei's mandate to look after communities. That's not, they have other issues, that's not their issue. But I would hope that that is something that is of value to government in general. I also think you have to look at the bigger picture. So if you're removing those clinics out of rural areas, what other industries are going to suffer? There's other jobs that come in with the healthcare clinic, not just the physician or the nurse practitioner. There's support jobs. Those are good jobs. If you want to have new families and new housing in rural areas, you've got to have the services. And I'm a pharmacist, so allow me to digress into pharmacy a little bit. But those rural clinics also support rural pharmacies, and government is getting a really good deal with those rural pharmacies by giving immunization services in rural communities, addictions services in rural communities, minor ailment prescribing, healthcare advice, triage, prescription delivery. You know, I've given many seniors flu shots in their homes. I think you have to consider the other industries that those health clinics are supporting that is not costing government anything to provide. We met with the provincial government's Economic Advisory Council, and they sent a letter to Premier McLaughlin back in December 2018, and they said about our proposal, this concept seems to present a unique opportunity for government to make an important economic investment in a rural area without incurring extra spending, and at the same time enhance the health and well-being of island residents. So just to cap off, what we would like to see happen is we would like government to support a primary health care clinic in Crapo. Our model of one physician and 2 nurse practitioners is very economical because they only need one practical nurse and 1 medical secretary for that number of practitioners. Also, each practitioner needs their own space, so they don't share exam rooms, they don't share their office. So if you put more practitioners under one roof, you're not necessarily saving on rental costs, for example. Plus, if we had 1 physician and 2 nurse practitioners, we could clear up all the people on the provincial registry in our area, which would be huge. I also think it's important to note that having the primary care clinic in Crapo will not cost government any more than it would to provide that service in Cornwall or Charlottetown. We also don't think it would be tremendously difficult to recruit a physician to Crapo. Crapo's rural, but it's not remote. We're 30 minutes from Charlottetown, we're 30 minutes from Summerside. The highways are very good in our area in each direction. We're only 15 minutes from the Confederation Bridge. And Lfpei has said that the physician who takes a position in Crapo would not need to do rounds of the hospital, which would be appealing to many physicians would find that appealing. And there's just some pictures of our new facility. We have 8 exam rooms and 3 offices, large staff kitchen, staff washroom with a shower. It's new, it's bright. We are ready to go. We're just waiting for government commitment. Thanks.
Well, that's a great presentation, and yeah, I think what we'll do is we'll open it up to the floor for questions. We'll just take it easy. We'll take it easy. We'll give the members who are on the committee first crack at the questions, and then we'll let everybody in. So we'll start with Heath MacDonald.
Well, first of all, thank you for coming in. I've been in your facility during construction and thereafter, and it's a very nice facility that you have in Crapo. Some of the things that I'm glad that you came in and you took us up on the opportunity, because there's a lot of things in here that I think when you start looking at this, you start looking at the facility itself, and it's, you talked about preventive health care, which we heard last week again, and those numbers are astounding. Transporting specimens, fundraising for supplies, those are the types of things that, along with the numbers, obviously the health registry continues to grow, and how you could decrease that by executing a better plan, and not your plan, the plan of government or the former government. And I was there, so I'm not taking any sides. I think we need to progress with a way forward with this. The government talked, I believe, and it might have been the honourable member to my left, some of their ideas in regards to hubs. And I'm going to go right to the point, but to me, my definition of a hub would be that model. Now, there's been $5 million set aside for hubs, but some of the stuff that you're doing already seems to be part of that type of a hub, I suppose. So I guess when's the last time you had a meeting with, I know you mentioned it, but how long ago was the last time you had a meeting with the minister?
We met with Minister Alward a few months ago. I'm not sure exactly when. It might have been October, does that make sense? I think we don't know enough about the hubs. We haven't, as a member of the public, I don't think we've gotten a lot of specific information on that. My concern is just that if that hub includes consolidating clinics, they need to be very careful to consult with the affected communities to make sure there's not any unintended negative consequences in the rural communities. And yes, I think we could definitely have a healthcare hub in Crapo because we wouldn't be getting rid of anything in that case. We'd only be adding healthcare hub. It wouldn't be impacting other communities per se.
Yeah, I think, to pursue, I think that's an avenue that definitely, if there's anything that this committee could do, would be to pursue that model and find out exactly what it is, first of all, because no one seems to really have a definition of it. although the money is supposedly there. So I guess, and I certainly know how strong your community is and how far it reaches into the South Shore and even towards the North Shore to some extent. So I just find this, after listening to this presentation by you, clarifies a lot to me. And yes, there's things that Lfpei does, and for some reason we shake our heads and say, why do you do that? And I'm sure they have their reasons, and they're not here to answer those questions, and that's fine. I think you guys done a tremendous job. I think you continue to be persistent, and I think you have the potential to maybe be diverse enough is what healthcare needs on Prince Edward Island, maybe across the country, that we need to be investigating and practicing these types of avenues to better succeed at healthcare on PEI. And I think that's something that we're kind of overlooking. And I think, and I'll be quite honest, a lot of the information that you presented here today, I wasn't familiar with. And I think that's important for us all to hear it. And I'm sure the media hopefully is going to present some of it too. But I think you keep up the work, and I know there's going to be a rainbow at the end of this tunnel for you guys, because what you're doing is phenomenal, and I think it's only going to lead to other communities doing the same thing. That's fine, Chair.
Thank you, Mr. MacDonald. Did you want to comment to that, or no?
No.
Okay, perfect.
I hope he's right.
We'll move on to Jamie Fox.
Thanks, Chair. I'd like to recognize you both, Matt and Elmer and Lisa. You and I have had many conversations on this topic, and I'd like to also take the time to recognize the people in the gallery. I do definitely know that you have the support of the community in the area in moving forward when it comes to healthcare services in Crapo. And my position has not changed. I think that we need to have at the start, until we can find a doctor, enhanced nurse practitioner services there. I publicly stated that. I think we do need to look at how we recruit doctors in the province. My understanding, the department is looking at that. I'm a little bit concerned with the comment when it was made that said that somebody told you couldn't advertise. I'd like to know who told us we couldn't advertise for that position. I don't think that's the right position to take. A couple of points is, number one is, as a minister responsible for communities, I know one thing I hear when I talk to mayors across the province is the importance of services in these small municipalities. And when we erode services in small municipalities by either limiting either a rink or a post office or some type of community center, then the growth of the rural community that seems to falter. And that's one message I'm hearing very strongly across the province when I talk to all the mayors, which is roughly 63 of them, that they're all trying to juggle and be competitive with their neighbor next door to ensure that that small little town exists and it continues to grow. And I think a key point is here that, when we look at PEI as a province and how it's located, we're not a long distance to get from anywhere to anywhere, right? Today I've gone from Brackley to Montague, back to Charlottetown, I have to be back to Montague directly, and then back up home again. So we have a luxury that where we can travel between communities very easily, and I think that's a plus. But one thing I think that, and this the question is, do you think that the Crapo area is a special case because of its location and the classification by Lfpei with the catchment of patients? Because you alluded to it. The Crapo area doesn't just pull in patients from Queens West. It pulls in patients from Prince East. So when we look at the locating of a doctor or nurse practitioner in that area, I think it's a special circumstance because of the catchment that it draws from. Would you agree with that?
Yes.
That's what I thought.
Jamie Fox.
Thank you. The next thing is that I always found interesting, I've said it in the House a couple different times, is when we talk about reducing our greenhouse emissions across the province. I think in the last sitting, or maybe the sitting before, I made a comment that is it not make more sense to have 2 or 3 people driving from a place into a hub model or clinic than having 1,000 or 2,000 people traveling to get them patients to another area? And I think I'm answering my own question, right?
We think so.
Right? We do,
Agree.
you know? But I think a point being on this chair is that I don't think we're considering the effect of moving a patient or a person that needs medical health to Charlottetown or Summerside when we talk about our families. So I took my case. If I have to take mom to Charlottetown or somewhere out of Crapo or that area, or dad when he was living, then it affects me personally on my life because I have to take time off. Or what do I do with the kids because I can't get them to the babysitter because I have to take them up? And I have to wonder if have you had any conversations about that effect on the social aspect of other families?
Definitely. We definitely heard those comments back in our health survey. Yeah, definitely.
The only other thing I want to ask is touch on is, I'm really interested in the partnering model. And that's one thing I've been saying to municipalities, is I think we need to look at, as the MGA comes into effect, we need to look at partnering with services across regional boundaries, or even though they don't share a boundary, they need to partner. So can you explain or expand on how we can look at partnering models on what you've built, or how we could expand on that?
Do you mean public-private or municipality partners?
Public-private municipalities, like I think.
Well, I think what we've established in Crapo, you know, and I've used this term before in different releases, but we've created a center, a turnkey operation through either private funds or community donated funds, to create a center that is turnkey for government to place any number of healthcare professionals essentially in this eight-room clinic. So the vision we have is 1 physician and 2 nurse practitioners. That can easily be accommodated in our clinic, and it's turnkey. We've handed it to the government on a silver platter. Here you go. Recruit, encourage, incentivize, whatever needs to be done. We've built it, so, you know, get them to come and use the clinic. So that's, I think what we've created is a clear definition of a public-private model. Unfortunately, too much of it is being downloaded onto communities that don't have the resources. We're all volunteers, we're all busy people with other jobs, and unfortunately so much of the medical care is being downloaded onto small communities and volunteers. And whether it's driving specimens around or fundraising for Band-Aids or whatnot, that's all being downloaded off on the community. So at some point, government's going to have to come in and start taking back a bigger piece of this pie. Only so much, I think, can be expected to fall onto the communities.
Thank you.
Thank you, Mr. Fox. Tricia Altas?
Thank you, Chair. And Matt, you just really just led into what I wanted to speak about as well, and then some of the questions I had around the messaging that we've heard from the previous government and now the current government around the need for communities to be involved in recruitment, which I would agree with, but the difference between being involved and supporting communities in recruitment and offloading or expecting communities to take on the bulk of the responsibility on their own is a significant one. And you know, what you've described here in terms of the model you've created, the incredible support that is behind this in the community, I can't actually imagine anything more that a community could possibly do to be active in the recruitment process, and I think that's quite incredible. One of the things that was mentioned by my fellow committee member was the idea that we live in a small island and you can drive pretty much anywhere, but of course, you know, we not everybody has access to a vehicle all the time, and he did also mention that it's, family members are often responsible for driving family members to appointments and the strain that puts on families. The other piece I wanted to add to that is that doctors, particularly in rural areas, are a part of the community, right? And, that losing that, you really lose a big part of what your community is all about, and that connection that doctors can have with their patients and need to have to really provide healthcare through wellness, and preventative care all the way through chronic illness. I just wanted to ask, well, first of all, we've heard that there's a new relationship or new commitment with the Medical Society around recruitment. Is that something you've been engaged with in any way or been briefed about? Have you met with the Medical Society at all?
No, we haven't, although we were speaking about this earlier amongst ourselves, and we think that's positive. It certainly sounds like a step in the right direction. And you did see my slide. We're engaged in recruitment as much as we can be. However, ultimately, it's government or Lfpei who's going to be showing all different practice sites to physicians and ultimately going to be signing a contract with the physicians. So they have a huge amount of control. They say they don't, but when we've met with them, they have indicated that they can't tell physicians where to practice, but they have a huge influence on where the physicians go. For instance, Jan Maloney, who is so happy to be in O'Leary. He and his family are so happy to be settled there. They came from South Africa. And when I asked him, how did you pick O'Leary? He said it was the only place they showed me. The only place they showed him. So that's good because they did need physicians in O'Leary, so wonderful, he's there, he's happy. But then for Lfpei personnel to tell us that they can't tell doctors where to go, well, they do have quite an influence on where they end up, absolutely they do. The family residency coordinator last year, Dr. Curtis, told me that over 90% of physicians now are choosing to be salaried. And definitely Lfpei does have more control over where those people practice because they're employed by government. So we're engaged in terms of, maybe taking potential candidates out to supper, getting them in touch with the doctors who are in Crapo now. But that's, there's only so much a community can do. You can show them around, help them with housing maybe, like show them what's available, but a lot of it's still in government's hands.
Trish?
Thank you. And since the advertising model from government has gone from specific locations to these broader, Queens West, and have you had any prospective doctors being, directed to your community, either just even for a visit or to consider your community at all as a result?
No.
Okay.
Trish?
One more question. So I also do find it quite concerning that you were told that you were not allowed to advertise, and I would be very interested to hear, where exactly that came from, and, what the consequences would be of when you think not allowed, what is the next step? Again, I just have to reiterate that, this community has really come together. That's what we're asking communities to do. Why on earth would there be you be stopped or blocked from recruiting when that's exactly the type of thing, that's what we're asking you to do. So yeah, I guess I don't have a question other than I would like to know more about how that went about. How were you told that?
They just said it was confusing because it's not actually Crapo, so they didn't want to see Crapo that mentioned on any websites. They said that was confusing because the position was actually for all of Queens West.
Trish?
All right, that's it for now, Chair. Thank you.
Was that verbal confirmation or was that in a document?
No, it wasn't in a document, but it was very clear at the time.
Thanks. Peter?
Thank you, Chair. Firstly, thank you all for coming in, Lisa and Matt and Elmer, and I, of course, have been in close contact with you over the last couple of years as this has all unfolded. And I also want to welcome everybody to the gallery. I mean, all of my friends and neighbours, and Tom and Fran and Judy and Catherine and Joe and Lauren, all people who have been involved from the very beginning and representative of, as you said, the hundreds of people in the area who felt abandoned when medical services that had been provided in the South Shore region since the 1800s were no longer there. The effort of the community, I mean, you cannot stress enough how much vigor, how much effort has gone into getting a physician, or I should say medical professionals to the area. And we need to be careful that when we talk about, whether it's talking about recruitment and retention or any other aspect of this, that we're not simply talking about GPs here, we're talking about all of the other allied health workers that could and I believe should work in a collaborative medical clinic such as I think you would like to see in Krakow. So you have done an enormous amount, and communities can do a lot, and you have done a lot, and as Trish said, I'm not sure how much else you could have done, but you do not have all the tools that are required to secure a doctor. That requires a relationship with government and a sympathy from government to come forward when called upon. And I know we've been through 2 administrations and many years of advocacy on behalf of the community in the area, and that seems to have fallen on deaf ears. And I'm wondering why you think, at least from your perspective, that Lfpei seems unconcerned about placing a doctor in the South Shore region.
When we met with Deputy Minister of Health, Mark Spidell, he raised a few different points, and he felt that it would be very, very difficult to get a physician who would want to practice in a solo practice. You know, it is true that many physicians want to practice in a group, but if you look at the last 5 years, many physicians are choosing solo practice. So Dr. O'Moran in Rustico, Dr. Stacy Champion in Charlottetown, Dr. Nackby in Summerside, Dr. Casey in Cornwall, they could have worked anywhere and they chose solo practice. So it's certainly not impossible. They are looking at the registry numbers very superficially, and when we tried to explain what the registry numbers mean for our area, they did not want to hear any further explanation on that. They just started talking about these healthcare facilities with more physicians under one roof. They talk about Dr. Giordani leaving, and that maybe left some concerns about practicing in the area, but we now have practitioners in the area that any potential physicians could certainly talk to and see how lovely you know, the patients are in the area. He also, Mr. Spidell talked about having those larger healthcare hubs, and that way you could expand services so that people could have appointments with a physician or nurse practitioner in the evening or on weekends. I find that flawed thinking. There's lots of facilities, the healthcare hubs in Nova Scotia and also in Charlottetown. There are facilities that have many doctors practicing under one roof. They're still not offering evening or weekend appointments because doctors don't want to work in the evenings or on weekends. So I'm not sure that that's going to facilitate recruitment, asking them to do that.
There seemed to be a bit of a disconnect between what was surmised as being wanted by way of a service and what the reality was for what was being wanted on a service. So that would speak to perhaps a lack of either familiarity with what the patient population wants and or a lack of consultation into the communities and for what the patient population wants, because if the key selling feature to these large hubs of 4 to 5 physicians is being able to have Friday evening appointments, I don't think that's paramount in the consideration in the minds of many who want a doctor. Full stop.
Peter?
Thank you. Of course, my own work experience prior to the job that I'm in now involved being a primary healthcare giver in a solo practice in rural PEI, just along the road from Dr. Visser, and we worked in collaboration on a number of cases over the years that I did that. And I don't think I'm that strange that and unusual that I'm the only person who wants to provide that sort of service in a rural area. In fact, I think one of the great selling points of Prince Edward Island that governments overlook is that we're not the same as anywhere else, that we have a distinct character and personality to this place that I think would be very alluring to a large number of not just health professionals, but professionals generally. And I don't think we've done a very good job of selling that. I think we have done it in a piecemeal manner. And I think when we look at the recruitment efforts and the recruitment system that currently exists within healthcare, it's incredibly fractured. It's not coordinated. We have bits of Health PEI doing it. We have bits of the Department of Health doing it. We have now integrated the College of Physicians, the Medical Society. I'm not saying that's a bad idea, but I'm not sure that we have a single coordinated, integrated, unified approach to recruiting medical professionals to the island. I think that's a real problem. I'm wondering whether you have spoken with anybody in the department about exactly what their recruitment system looks like and whether you offered any advice on how that could be improved.
We have over the last 2 years, we've had those types of conversations. Although I don't know a lot about how all of that works, because as you mentioned, there's a few different pieces that go together in terms of recruitment. We did offer advice in terms of, which I've heard on the other MLAs have spoke to on the floor of the legislature, about streamlining licensing. That's always been an issue that comes up over and over again, that it takes too long, there's too many hoops, it's too confusing. And again, I certainly don't know much about that, but this is what we hear from physicians. And just, if we could subsidize more medical students going to Dalhousie or MUN, or have our own, either way, but Canada is facing a shortage of family physicians. It's not going to get better. We need more of them, and it would be nice if we could subsidize more seats for medical students. Only 10% of applicants get into medical school, only 10%. So there are many, many more individuals that would make lovely doctors, I have no doubt about it, but we need to make space for them.
Just Elmer.
The concern that I have, Mr. Chair, is that as one of the vice chairs of the committee, I have at no time has the powers that be ever contacted our organization, our volunteer organization, to ask about what we're doing and how we're done it. In other words, I would see this as a possible bragging point that they could be utilizing to tell the story of what communities can do if indeed they're committed, and the biggest thing is passionate about what it's all about. Because healthcare is not going to go away. We've got a senior citizens facility in Crapo that's providing a valuable service. Put there a number of years ago by some gentlemen who saw a growing need in the area. And yet we've got presently people who are in that facility, and for one reason or another, who are missing out on an opportunity to have a doctor drop by to just deal with issues that are happening on a daily basis. And this causes some of us on our committee to be quite concerned about, why are we not being watched? Why are we not being asked for something about what are we doing in order to engage the whole community? Because this is not foreign. We've lost our arena a number of years ago. The easiest thing for us to do was to wring our hands and say we can't do anything about it. That isn't what we did. We didn't necessarily go to government at the time until we could make the case that we can do this. Yes, we might need a little bit of help at the end. But we got a facility there that we own now. It's all paid for. And it's meeting the standards of what is required of the people. I've been involved in tractor pulls. I've been involved in exhibitions. I've been involved a long time in the community. I don't live in Crapo, but I chose Crapo as a place to spend my volunteer time. And I'm not the only one. There's all kinds of others who have done that because they believe in this area and the need to have the area progress. But I guess I've always wondered why government has never saw fit to ask us, what are we doing in order to get people to become engaged?
Minister Fox might have to leave, so is there any?
Yes, thank you very much for all you do, for the constituents in that area, because you guys are doing a great job, and you truly are standing up for, the residents of the South Shore, and I applaud you for that wholeheartedly. I do have to leave, and I thank you very much for coming today, and the other people that have joined us today. So, with that, thank you, Chair.
Yeah. Peter, do you have one more question for now?
Sure. Thank you. You mentioned that the three areas that you have been active in are in recruitment, in fundraising, and in working with government, and clearly you've done an enormous amount of work in all three areas there. We've talked a little bit about retention, about recruitment, but nothing about retention. And I mean, part of the tragedy of this story is we had a doctor who took over in what seemed like a very well-organized, seamless transition from Dr. Visser, and yet that doctor left. And one of the real challenges that we have here on PEI, whether it's in the South Shore region or anywhere else, is retention of the medical professionals that we bring here. Oftentimes, we don't look at the full range of supports that have to be there in order for professionals to come, particularly to rural areas of our province, and settle down and feel that they are well supported. Many times a doctor will come with their partner, and that partner may also be a professional that requires to find employment here on Prince Edward Island. That's not always an easy thing to do. They may come here, we hope they do come here, with young children. And sometimes those children have to integrate, always the children have to integrate into the community. And again, I'm not sure that the supports are consistently there for these people. So we need to look at the full range, the full arc of supports that are required to retain the medical professionals that we attract here. Health PEI, you mentioned, one of you mentioned, is not responsible for communities. Absolutely, they're not. They're responsible for the delivery of healthcare here on Prince Edward Island. But communities are strong because they can provide a range of critical services to their inhabitants, to the community members. And when we start to take those services away, whether it's a rink or whether it's a medical service or a rural school, then those rural communities wither. And I would love to see a retention effort particularly from Health PEI here, that recognizes the full range of supports that are present. I'd like to talk about Jennifer Woods, who is the nurse practitioner currently there, and you described her workload at the moment. She's booked 4 weeks ahead. She's working by herself. I'm desperately concerned about her well-being. You talked about how she's taken a lot of the stresses off the community, and indeed she has, but those have landed squarely on her shoulders and her shoulders alone. And I am concerned that unless supports are in place or something is done to protect Jennifer, that is not sustainable. And I'm wondering whether you have again talked to Health PEI or anybody in government about those concerns. I see from the nodding of your heads that you share the fear that I have, particularly when it comes to moving that second nurse practitioner from Cornwall, where they're currently based, although I understand they move around. There's a clear need for more medical services in Crapo. The people want it there. Have you spoken to why that second nurse practitioner has not been moved to Crapo?
Many times.
Yeah.
Most recently, we spoke to Kelly Rayner, who is the new manager of primary care for Queen's West. And because I said, what's the downside to having both nurse practitioners in Crapo? They could support each other, they could collaborate with each other. And she said it would just be too disappointing for your community if we have to move them later. which doesn't solve our problem today that we have 2 nurse practitioners working independently with a caseload they should never have. And she is fabulous, and it would be a shame to lose her because she is wonderful and she's providing such a valuable service.
Yeah, there's an inherent irony there in that there's a clear recognition that we don't want medical professionals practicing alone, and indeed they don't want to practice alone, but yet poor Jennifer, who is struggling under an immense patient load, is currently left to practice alone when there is a clear solution to the issue available, which can be implemented, I would think, with a press of a button fairly quickly to eliminate that real potential of overwork.
So we'll move on to Rob, and then we'll come back around to Rob Henderson.
Thanks, Mr. Chair, and thanks to the South Shore Group for coming in here today. I really appreciate that. And I, as a former Minister of Health, am quite keenly aware of the challenges that you're facing. I have had the opportunity to meet, certainly with Lisa many times, and I certainly can appreciate your challenges, but also we raised the issue about trying to get a sense of what these healthcare centre hubs are all about, and the $5 million that's been allocated towards that. And I too have been having a hard time trying to get any answers to that. I know you've been watching the legislature quite closely, you've been following the transcripts, and you know, I sort of look at what you have in Crapo is a healthcare centre hub as a structure, as an infrastructure, as a facility. Now you need the healthcare professionals, of which you have a number of, to round that out and make that work. And I'll also say you have the same thing in Tignish, you have the same thing in Tyne Valley, O'Leary, the list goes on. I'm curious to get a sense of, you know, you put a fair bit of infrastructure, and I'll assume a fair bit of money, that was not government money. So can you give me a sense of how much money you did spend between both you as a pharmacist and your infrastructure, as well as the organization in the equipment that was put there? Just to give me a sense of how much money that actually did save government that might be what we're trying to put into a healthcare centre hub that already exists.
The medical equipment was about $15,000 that was spent so far. The supplies are running about $3,000 a year. I'm not going to comment on what my business spent to build a 3,000 square foot building that half of it remains empty, but I will tell you that every business owner we spoke to said do not do it. One Minister of Health said do not do it. But you know what, it was the right thing to do, and sometimes even though it's hard, you have to do the right thing.
Rob Anderson?
Well, I guess one could extrapolate what 3,000 square foot construction costs would be, so you don't have to say the number as far as that goes. So anyway, that's kind of an interesting amount. One of the questions I'd asked the Minister many times was the Medical Society. Obviously there are agreements that the Lfpei government has with the Medical Society. There are issues around, you know, physicians have choices to be fee-for-service and salary, and there are restrictions to what you can do as far as to restrict the movement of a physician within a healthcare region. Are you aware that there's anything that has changed in that? Because that's once again another issue that I have some questions about when it came to these healthcare centre hubs. How can you force a fee-for-service physician into these hubs if they choose not to go there? Yes, you can have some influence on salaried physicians, and we have seen our salaried physician complement comparable to our fee-for-service change quite a bit. But that's sometimes a component of the remuneration of physicians and the structure that they signed within the master agreement. You've seen Nova Scotia has recently signed an agreement, and they increased significantly the rate to fee-for-service physicians to try to get that balance a little more equal, comparable to what we have in PEI. Are you aware of anything that has changed in that arrangement with the Medical Society?
I wouldn't be privy to that information, I'm not sure. I just feel that we should be concerned that they've removed the community names from the job postings, as well as the Deputy Minister's statement on this vision for these hubs with larger centres. I think we need more information about what exactly that's going to look like.
And that's I say we'll go with 3 questions. I have more, but we'll go with the third one here for now. And that's a good point. I mean, one of the things that I've been trying to say is I'm trying to get an answer on what these hubs are and how do you drive physicians and healthcare professionals into these particular hubs. And I can't get an answer. I'm told it's kind of a Green Party initiative, and I'm assuming they've been in consultation with you on how these things sort of evolve. But yet it doesn't sound like what the definition, as you read in the transcripts, CRAPO equals what the Green Party's initiatives were in these hubs. But so when they're talking $5 million, would you as an organization have any suggestions on how you'd spend $5 million to improve the situation, say, at CRAPO? Or at least a portion of that $5 million? I wouldn't expect it all to be there.
We don't need anything near five. We're not.
Yeah, that's right.
In fact, they could do everything we're asking with almost no investment, no further investment than what they're already spending. There is 1.8 million, I believe, was announced for collaborative care. Some of that we would like to see to bring the second nurse practitioner to CRAPO, so we would have two, and to focus on recruitment of a physician. We know that there's not going to be a physician for us tomorrow. That's okay. What we're looking for is a commitment by government to recruit a physician to CRAPO. We're not looking for infrastructure costs. I believe the collaborative care money was for rent because it was in the capital budget. So, we would be looking for rent, but no more than what they would have to spend elsewhere.
Yeah, I think it's important to note that we're not asking for anything new that we didn't have before, except for perhaps the introduction of two nurse practitioners working collaboratively with the doctor that we've had since, I think Elmer said, early 1800s. So we're not a new area, a new region, a new community that's asking for, all of this either infrastructure or personnel to be placed. We're simply asking for what we've had for 100 plus years.
Okay, we'll just move on to Trish and we'll come back.
Thank you, Chair. My committee colleague had just mentioned the Green Party connection to healthcare hubs, and specifically I just wanted to clarify that our proposal around rural healthcare hubs in no way would involve the centralizing of services in urban areas, such as you're describing the situation in Cornwall. Our proposal is to bring more services to rural areas, particularly around chronic care and long-term care and primary care support. So we also have questions about how the hubs will be actually rolled out by government, and I do hope that the collaboration around that continues, because we would like to be a part of those conversations. I wanted to just echo the comments that Peter made around that discussions of recruitment and retention seem to often completely miss the second part around retention. I wanted to ask if when Dr. Giordani had left CRAPO to go to Cornwall, and I know that was a different government at the time, but I'm just wondering, do you know if there was any supports provided to retain Dr. Giordani in CRAPO, or if there was any preventative sort of measures to keep that doctor able to practice in your community?
Dr. Visser recognized back in 2014, and Peter will be aware of this as well, we had advocated that government, we had met with Lfpei to ask for a nurse practitioner to come into his practice, where Lfpei would pay for the nurse practitioner. Dr. Visser would reduce his billings to make it practically cost neutral, because he recognized for one physician to come in and take on 2,300 patients was unreasonable. It's untenable. Nobody does that these days. We met with them for probably 2 years, and they never would see it our way. So that did not happen. That may have helped. This group wasn't together, so we didn't have as much of a concerted effort to welcome a physician like we would today, but certainly he was welcomed into the neighborhood. He lived not that far away. I met with him several times. We went out to supper, invited him over for barbecues, got to know his whole family. But the practice was simply too large, and everybody knew that was going to be a problem, but it seemed difficult to do anything about it. This situation that we're asking for now would have gone along, it would have solved the whole problem. If we would have had 2 nurse practitioners there with support staff, it would have completely eliminated the whole catastrophe.
Trish?
Thank you, Chair. Exactly. And I think that sometimes that narrative of, doctors don't practice the same way they used to, or they don't take on as many patients, kind of becomes sort of not an excuse, but it takes over the story rather than looking at, what are the positives for doctors who are now seeking more work-life balance and additional training, and what benefit does that bring to their practice and to the community, which is really the way we should be approaching this. You had mentioned that one of the reasons that were expressed to you about why the second nurse practitioner wasn't placed in Cornwall, in Crapo originally was, well, what if she chose to leave? What if she left? And I think that's a very strange way to approach this sort of situation. Sorry, did you want to?
Well, it wasn't even that. It is what will happen when we take her away. It wouldn't be that she would be choosing to leave. It's that if the physician that we hired for Dr. Visser's patients chooses to go to Charlottetown, we are taking those 2 nurse practitioners and moving them to Charlottetown as well, and that would be really disappointing for your community. So we want to not put you in that position.
Trish?
Okay, thank you. So that even worse than that, then I guess that it was the decision was already made that nurse practitioner would not possibly be able to stay because they would be moved.
There is the sentiment that the more we get, the harder it will be to take it away.
Right. So looking at, what do we do if we can't retain them instead of what do we do to retain the staff? And I think that there's a major shift in the way that we are framing the question. The original question around how do we not only recruit our doctors, but what do we do to support them to stay in our communities? And I have no doubt that when, hopefully, this situation is resolved and a doctor comes to Crapo, they will be incredibly supported by this wonderful organization of community members that has come together. Any doctor would be fortunate to work in your community. That's all I have for now, Chair. Thank you.
So is it okay for the guests if we try to shoot for maybe about 15 more minutes? Are you guys okay with that?
Whatever you need.
Okay, perfect. Okay. We'll move on to Heath MacDonald.
Yeah, I think we all know what the end goal here is for human resources. But at the present time, I mean, obviously you've got costs that you guys are enduring right now. And I'm just wondering, what could government do to eliminate some of those? Now, you talked about the $3,000, I believe it was, in supplies. You talked about $15,000 in equipment. Because, I guess I'm a firm believer in if you keep the motion going one way or another, maybe the end result will come quicker than maybe you think, or maybe it'll open up or continue those lines of communications with the medical society now that they're getting into the recruitment business, or with Lfpei and the ongoing impediments that you're having. So is there anything financial resource that government could do today to alleviate some of the pressures when you're talking about transferring specimens and you're talking about fundraising for your medical clinic? I find that, and I go back to it because I think you've covered all your bases and you've done a tremendous job. So I guess I'm just throwing that back out there. Has that ever been discussed?
We wouldn't dare ask. We've been here saying, we're giving you this, we just want cooperation. I guess with the specimen transports, Lfpei has to transport specimens for the nurse practitioner who's there now. So if they would take our specimens from the clinic, not to mention the environmental impact of that, it would save 2 people driving them in. That would be a big help. Were you going to
Just the lease payments.
Right, exactly, the lease. If we were to get the second nurse practitioner, then obviously more space would have to be rented, so that would help offset the building costs.
Heath?
Thank you, I'm fine.
Rob?
Just to follow up a little more on where I was finishing off last time there, just about the $5 million allocation, and my colleague mentions it's about having that in the budget. But the problem is it's in the budget under infrastructure. It's an infrastructure budget, which means it has to either be for equipment or building or something of that nature. So that's where I'm getting very confused again when To me, it's not, the money doesn't need to be into infrastructure. It needs to be into the recruiting component of things. It needs to be into making sure that we're compensating our physicians fairly. It needs to be into making sure that we look at scopes of practice and how we evolve into the types of services that Islanders need. I think when you look at little communities like Crapo, Tyne Valley, Tignish, the ones that I'm more concerned about in some of the answers I've been getting from the minister, is, they provide that infrastructure. It's all there. And so it's about really where we put our money. It's not, if it was inoperational, I could support it fully. I think that the $5 million could go a long way to alleviating a lot of the challenges in delivery of healthcare in the primary perspective. But when it's in infrastructure, the capital budget, then I'm kind of lost at why is it in there? So that means it must be for either equipment, and if it is for equipment to do more in these facilities, then I can be very supportive of that. But if it's in buildings, I don't see where we need more money into buildings because they're already there. So that's just my final point I wanted to make on that.
Did you want to comment on that?
Well, the only comment I would have, Mr. Chair, is that I'm sure we're all familiar with the movie Build It and They'll Come. Well, we built it,
yeah.
And we got everybody putting roadblocks in the way that they can't come.
Yeah.
And that is a bit of a discouragement, because we saw very early in this whole putting together the board of directors and talking about where to from here, was that we had to have infrastructure in place, or it certainly was not going to happen. And there was a certain amount of excitement by those of us who were watching it evolve. As we drove by, we were watching the carpenters do the work, and all of a sudden it was a reality. And we're very proud of what we've got there now. But my goodness, we're at a loss as to why there seems to be more roadblocks continually put across our pathway before anything is decided by the powers that be as to what we're in need of.
Yeah, well said. Peter?
Thank you, Chair. Another movie, I think it was called The Romancing of Dr. Lewis. I don't know if anybody here ever saw it, about a small community that goes to extraordinary and quite ridiculous and very humorous lengths to recruit a doctor to their outlying, in this case, Newfoundland community. Brilliant film, highly recommended. But this isn't funny, of course, and despite all of the efforts that you have done, we're still without a doctor here. I think it's important that I respond to something that Robbie said about the hubs, because this has been a continual story from the third party that they're confused about what these hubs are. The opposition is also confused about what these hubs are. We had it in our platform very clearly articulated what our idea of what a rural health hub was. And I think it's really important that we don't sow confusion here, deliberate confusion, that in supporting what our idea of a health hub is, we are therefore not supporting what a collaborative community healthcare clinic like the one proposed in Crapo is. Those are two entirely different, not in competition. They are things that can absolutely live comfortably together. So I'd appreciate it if any illusions about the support for one suggests that you are not supportive of another. That's absolutely not the case. For us to have a properly integrated, patient-centered, cost-effective healthcare system is going to require provision of services at many levels. We already have a regional provision of services to a certain extent. We have the IWK, we have the heart specialists in St. John. So we will have a regional approach in some areas. We will have our two primary, our two major hospitals, the PCH and the QH, and then we will have a number of local areas or local facilities where these primary health care is provided to people. I just wanted to make it absolutely clear that, I have no idea what government is doing when they talk about health hubs either. But let's not make that a point of contention. Let's just say, okay, you carry on with whatever you're doing, but let's make sure that we provide provision of services that looks at that they are patient-centered and we're looking at outcomes. And you will find all of the literature suggests that local provision of many of the services that are contemplated through a clinic such as the Crapo Medical Clinic should be provided locally. The preventive services, the care for chronic illnesses, some of the primary care, and then you send the appropriate stuff to other levels of the system, whether that's a health hub, whatever that may be, or one of our primary hospitals, or off island if that's the most appropriate place to get the best health outcomes that we want. There's one thing that I need to tie up before we finish here, and it's about the vacancy and how that's being advertised by Lfpei. You mentioned in your presentation that it's not being advertised, and you were, of course, a number of people have talked about you being unable to advertise, but Lfpei is advertising, false advertising, fake news if you like, that this is a position in Charlottetown. Have you approached them about how on earth that happened, for an explanation and also a commitment to correct that?
Anytime.
And what's the response that you get?
Well, it still says Charlottetown today.
Okay, that's all I have to say. Thank you, Chair.
Well, just in summary, I think that, Corey Deagle?
Thanks. I also don't know quite what the health hubs are either, so I'm not going to get into that debate. I'll be as confused as everyone else on it. But what I can say is that representing Montague, I understand your frustration and the bureaucracy of Lfpei, and I don't understand what they do half the time. I have an emergency room that's closed more than it's open and reduced hours, and it's usually just 100 excuses of why they can't do something and not a reason why. Yeah, crisis is what it is. So, and I know I didn't speak too much throughout because I don't know. I don't normally sit on this committee, and I didn't kind of know. I wasn't as educated on your issue as I probably could have been. But I just, as Peter said, I just find it ludicrous that they won't even allow you to advertise it as Crapo. It's just typical bureaucratic nonsense, really. Who tells you this? I know Peter kind of did ask that, but who tells you?
Recruitment.
Recruitment.
And I mean, we did it anyway, so it's fine.
And-
But it just sends a message, I guess, at where their priorities are. We didn't feel supported. We don't feel that they're really recruiting for Crapo. Maybe they are, but it doesn't seem like it from our perspective. So that's all we can speak to.
Corey?
And you said the medical society has a lot more influence of where the doctors practice. Is that what you?
Well, Lfpei does.
Yeah.
It's been they've said to us on a number of occasions that they can't tell doctors where to practice, but they do have quite an influence on where they end up. For sure they do.
Yeah. That's good. Thank you.
I'll just ask you, I think the committee did a great job of putting a spotlight on what's happening. Just to make your case, is there 3 final points, or maybe just summarize, what would be the 3 points that you'd want to leave this committee with?
We want those 2 nurse practitioners in Crapo, ASAP. There's no barrier to that. There is no extra cost, and it would mean a great deal to our communities. And those nurse practitioners would like to practice together as well, is my understanding from them. We would like a commitment that a doctor will be committed to Crapo, which would allow us to move on and do some other work besides engaging government and advocacy. We've done a lot. We've come a long way in 2 years. As I mentioned, the community is engaged, and by that I don't mean Crapo. I mean a number of communities in the South Shore area. And we would like to see government match our level of enthusiasm. Did I miss anything?
Well, on behalf of the people in this committee, I think that you have, besides the odds, you've set an unbelievable precedent for Prince Edward Island and small communities and done everything you can for your community. I think today, by coming in, you've done justice to the people who live in your community, And this committee will be discussing a lot of things, and you'll be top of mind as we move forward and schedule meetings, because I think that everybody here needs a few answers. So just Heath MacDonald.
Just a quick, Chair, it was a good question, actually, of 3 points, and maybe we could make a recommendation or even a motion to include those 3 points in a letter to the appropriate authorities in recruiting, retention, the minister, whoever we need to. I think that would be actually a really good segue of leaving this committee and these people.
Sure.
So I think
that's a great idea. Would the committee be in favor of that?
Need a seconder.
What's that?
need us a seconder.
Oh, we need a seconder.
I'll second.
Second, Trish? So, who? I don't know, maybe. We just got one? I think that's a good idea, so we'll summarize, I'll ask the clerk, we'll write a letter to the various stakeholders, summarizing what our guests had said, and as well, I think we'll be chatting here after our guests leave about future work plans. So I think I think today you did a justice for rural healthcare in Prince Edward Island, and I thank you on behalf of the committee.
Well, thank you on behalf of our committee also, Mr. Chair, and it was indeed an honor to be invited in, and also an honor to be allowed as much time as you were very graciously given to us in our particular situation. So thank you all so very, very much.
Thank you.
Take a short wellness break, and then we'll be right back. So thank you. So we'll move on. That was agenda item number 3. We'll move on to number 4 after that. It's just a discussion about the committee's work plan and prioritizing items here in the coming future. And I think after that presentation, we can have a discussion about how we prioritize and move on from there. All we have too is on February 19th, the Seniors Health and Wellness Action Plan Implementation Council will be in to speak. Dr. Olive Bryington and Sean McNeil will be in to speak on that. And then we've invited presenters, the Advisory Council of the Status of Women, Community Sector Network, PEI, Downtown Charlottetown Incorporated, the Navigator Street Outreach Program. And at this point, I think after that presentation, motion number 4, motion number 35, although important and not coming from the Legislative Assembly, we'll probably put those on further to talk about those later. So, Trish?
Thank you, Chair. So last meeting, we also passed a motion within this committee to prioritize recruitment and retention. And of course, the South Shore Medical Inc., that was one of the groups on the list. So it was great to get them in right away. I was just wondering an update on the plan to invite the rest of the groups underneath that heading and individuals.
Yeah, so they're all up. South Shore was invited, and then under that section, doctor and nurse recruitment agreed to on January 15th as next priority on the committee. There's been no letter sent from the time last week till now, so that remains open to discussion. We will send letters out to the Department of Health and Wellness, PEI Nurses Union, the College of Physicians, Surgeons of Prince Edward Island, the Medical Society, Tanya Nance, and those are the people on the list. If we want to talk about adding people on, this would be the right time to do it. Yeah.
So just to clarify, Chair, so those letters will go out as soon as possible, and that any discussion of prioritization is sort of after those ones are invited and hopefully scheduled, then prioritizing the rest of the list after that, based on the motion from last week.
I think yes. The sense of the committee is that that's becoming a very important issue, and it's important to all members of the legislature, and we will prioritize accordingly. And we're going to work with Sean and Emily to get those letters out this week. Now there is an opening. There is an opening next week in the schedule too, as well. I'd like to when you're sending letters out to different departments and heads of things, it takes them a little bit longer. So there's an opening there to explore further with maybe community groups. If you have anything, maybe a community group that can talk about various recruitment and retention issues in the province around that's great. Okay. Corey?
Did the committee send a letter to Lfpei regarding the Kings County emergency room?
No, not at this time. No, it's on the list though. It's probably under the second section. Would you like to?
Were we going to ask them to come in? Is that? Did we send that off yet? Is that? I don't know.
Yeah,
Sean, do you know?
that was and here's we haven't sent that letter off yet, but it is on the list. If you want to, it becomes a sense. Do you want to leave those letters separate and bring those groups in, even though they might be the same people, to come in and talk about those issues? Should we put that in the same letter, or do we leave those things? Sorry, Corey?
Well, like the hospital, the emergency room, that's kind of it's probably going to take more than, like, are you saying if they're coming in to present, to get them to present on 4 different topics? Is that?
Oh, I'm just putting it out there for discussion.
Might, like, perhaps on recruitment maybe or something, but like the emergency room, that could take like an hour and a half, an hour alone. I don't know.
So we have that under the Department of Health and Wellness and Lfpei. Is that who you'd want to send it to?
Lfpei.
Lfpei? Yeah. Okay, so we will, does the committee agree that we can bring that into the top priority list to send a letter out? Trish?
Just to clarify, so to a letter sent to Lfpei specifically to talk about the Kings County Memorial Hospital and like several situations related to it, so whether it's retention, emergency. Just the emergency room specifically.
Why is it closing? Why is the hours reduced? How can we fix it? How can we fix the issue? Not necessarily just, it's easy to point out all the problems, I guess, but how we could fix the issue and I guess what they're doing to address it.
Hannah?
Thank you, Chair. Obviously, I wasn't here for this meeting, but I had gone through the transcript and appreciate the update with the work plan here. It was my understanding that the initial, as my colleague mentioned, the initial set on doctor and nurse recruitment was clearly set as a priority. So can you give us a guideline of when those letters are going to go?
Yeah.
Because we only have 7 slots, as I see from the work planning remaining. So, if we're adding another one, which I appreciate from my colleague there, we have 1, 2, 3, 4, 5. We have 6 items for the 7 meetings that would be priorities. And the idea would be to hopefully have those 6 things all happen prior to the sitting.
Yeah, sure, absolutely, and that is our priority.
Okay.
There was a transition with the clerks, and there was a snowstorm in there.
Sure.
And so we only got, last week in between there, we got the 3 letters sent out, but that is a priority, and.
And Chair, I appreciate, obviously, welcome to the clerk, and we've had a lot of shifts and changes happening, but I guess I suddenly realize how fast it's going to be upon us with all the things like March break. We actually and we have very ambitious schedules in all of our committees,
Sure.
but 7 slots remaining. We're probably going to lose a couple of those with snowstorms, let's be honest. So the other thing is that could we perhaps discuss storm plan and how that could affect rescheduling for priorities as well, so we can get as much done as possible.
Absolutely, yeah, we can
thank you,
discuss
Chair.
storm planning, no problem, and I think it would be fairly similar to the other committees, updates by 7 a.m., I do believe, and or if you want updates earlier, that's fine too as well, but that's a really good point. With the letters, is it okay, because we're trying to fill in those gaps, is it okay once we agree to the letter, that I might make a call to that person as well, to let them know that a presentation doesn't have to be done in months. We just need to speed this along. So I'll do my due diligence to try to get these groups in, and that's my commitment to the committee, if that's okay. Yeah. Perfect. Yeah. So, Court?
So sorry, where does that leave the emergency room?
I don't think we all voted, but I mean, if you want to move that we add the Kings County, the Lfpei to talk about Kings County Memorial Emergency Room to the current priority list under doctor recruitment and nurse recruitment, sort of that list, then I would support that, I guess.
Great.
A good motion. It sounds like you just made a good motion.
We'll move that motion, so,
Sorry, just for clarity,
Yeah.
has Trish moved that, or Trish has?
Sure,
Okay.
I guess I did.
that will go up, and the committee, the chair will guarantee that the committee, I just
Be careful of making guarantees, Chair. You could
Yeah.
guarantee
on the
that
record.
those issues will be prioritized.
The other suggestion,
Hannah?
I think, just from all other committees, that again, if committee presenters know that they're coming in to speak about a specific topic and that it's not, a large, complex presentation, that we are able to have more than one presenter in per meeting. So, it can make for it's harder for the committee members, but it's more productive if we are able to do an hour times 2, then that may be also an effective way to get, depending on how many questions we have, of course.
And absolutely, we'll try to do that, and I will do my best to communicate with these departments. And I know they get a little bit maybe nervous about coming in, but I think it's for the best interest of Islanders. And if you see somebody else that's been scheduled in, it's only because we couldn't fill in with the priority list. Would that be a fair at this point? I'm not sure. At this point, like that would be the only reason we would add other people in.
I do have a question in regards to that.
Sure, Sean.
February 19th.
Yeah.
We've got the seniors already scheduled, and
Yeah.
they've pretty much done a lot of the prep for that. They've arranged specific people to come in, they have their presentation good to go. I know it doesn't fit within what we said as the priority batch for right now, but can we go ahead with that date officially still? Is that?
Trish?
Yeah, I believe they were invited before we had this discussion of prioritizing this group, so I mean, I'm comfortable with that. I don't know how others feel, but yeah.
Yeah, and just as a follow-up to that, you can see in one of your handouts, there's 3 other groups who aren't part of that priority batch,
Yeah.
the Advisory Council on the Status of Women, a couple of others. Part of the reason that they had invitations out already, even though they weren't part of that priority batch, is they were in motion before that decision was made. People had reached out to them by telephone and started conversations, and that had kind of gone a little further during the pipeline. It doesn't necessarily mean that we have to schedule them ahead of the things that we're trying to prioritize now. That's just why they've already gone a bit further than some of the other things had.
Perhaps then that would be our fallback in the event that we have other gaps to fill, that would be our second choice of booking, would be, yeah, because there's a courtesy there to them having been invited.
Sure.
That would be my suggestion. Karen?
Yeah, it's a great suggestion. So, is everybody okay with that section? Are we okay with, do we have a motion on the floor? I think we do have one. Did it pass?
I think we moved it, didn't we?
Didn't we?
I
Kings.
think we moved it. There
Did we
seemed to
not
be
vote?
consensus.
I did my part. I moved it.
It seemed like we had committee consensus on Trish's motion when that came through, but
I would agree.
Yes.
Yeah, great. Okay, so is everybody okay with section 4? Can we move on to the next priority list? Yeah. That would just be under new business. This time, does any of the committee members have any new business? Okay, so at this point, we're going to look at, there's currently no presenter in for next Wednesday, so I will be working on that to try to get that time filled with our priority list first, and then moving on from there. So we will update you on Monday about the meeting time for next Wednesday. Trish?
Just to reiterate one point, that if presenters are, if we can schedule 2 on the same day, and that makes sense, like perhaps the department and the medical society might want to come together to speak about recruitment and retention since they're working together, that be a possibility, so we can.
Sure, absolutely. And that'll be duly noted, Sean. We're moving in that direction, so. Anything else finalizing? Great. Okay, thanks for the great meeting today. Can I have a motion to adjourn?
So moved.
Annabelle? Thank you.